Part 1. Introduction and Scientific Foundation. Have you ever wondered whether that age-old remedy sitting in your kitchen spice rack, ginger, actually has the scientific backing to justify its centuries-old reputation for soothing upset stomachs and nausea? Welcome to Rooted Health Revival, where we explore the fascinating intersection between traditional wisdom and modern research. I want to extend a warm and sincere invitation to all our listeners, especially those seeking evidence-based natural health solutions here in the United States and across Western Europe. Your incredible support, every subscription, share, and positive review fuels our mission to bring you accurate, scientifically grounded health information. Thank you for being part of this journey. Today we're diving deep into one of the world's most studied medicinal spices, ginger. This humble root has been treating digestive ailments for centuries, and remarkably, it continues to hold its ground in our modern world. In fact, ginger supplements currently rank among the best-selling dietary supplements in the United States, often outperforming popular options like green tea and echinacea supplements. But here's the critical question we'll answer today. Does the science actually support ginger's reputation? And if so, what's the most effective way to harness its therapeutic potential? Let's start with what we know from the medical community. According to Dr. Michael Curley, a gastroenterologist at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire, only a few relatively small studies have tackled these important questions. Most research has focused specifically on nausea and vomiting rather than broader digestive issues. However, and this is crucial, Dr. Curley emphasizes that the limited research we do have suggests ginger can be both safe and effective for treating nausea and vomiting in certain contexts. This isn't just folklore. This is peer-reviewed clinical evidence. So how exactly might ginger work its magic? The answer lies in two powerful compounds that give ginger its distinctive bite: gingerol and shogaol. According to Megan Creighton, a researcher and dietitian who studies ginger at the Queensland University of Technology in Australia, these pungent compounds are thought to ease nausea by blocking nausea-related pathways in both the gut and brain, effectively preventing the vomiting center inside the brain from getting switched on. But the mechanisms don't stop there. Dr. Keshav Paudel, a pharmacologist and physician who studies ginger at the Burrell College of Osteopathic Medicine in Florida, points to additional evidence suggesting that ginger supplements may ease symptoms by actually speeding up the rate of stomach emptying. This dual-action approach, blocking nausea signals while promoting digestive movement, provides a compelling scientific foundation for ginger's traditional use. Part 2. Clinical Evidence and Research Findings. Now let's examine the clinical evidence that transforms ginger from kitchen spice to legitimate therapeutic option. The research reveals some truly impressive findings across several key populations. Much of the rigorous research on ginger and nausea has focused on supplements containing dried ginger root powder, and the results have been consistently encouraging. Dr. Creighton notes that this form has been shown to help ease nausea in 3 primary groups: pregnant women, patients receiving chemotherapy, and individuals recovering from surgery. Let's look at the specific data, because numbers tell the story of efficacy. For pregnant women, in a comprehensive 2025 review of studies, Dr. Podell and his colleagues made a fascinating discovery. Pregnant women who consumed between 500 and 1,500 milligrams of ginger supplements per day showed improved nausea symptoms. Interestingly, while they felt significantly less nauseated, they didn't actually vomit less frequently. This suggests that ginger helps manage the uncomfortable sensation of nausea rather than preventing the physical act of vomiting itself. For chemotherapy patients, perhaps even more impressive are the results from cancer treatment. In a 2024 clinical trial involving about 100 adults undergoing chemotherapy, Dr. Creighton and her colleagues conducted a rigorous placebo-controlled study. when participants consumed 1,200 milligrams of ginger root powder per day with food, starting on the day they began chemotherapy and continuing for 4 days afterward. They experienced significantly less nausea compared to patients who took a placebo. These aren't marginal improvements we're talking about. These are clinically meaningful differences that can genuinely improve quality of life during some of medicine's most challenging treatments. However, it's important to acknowledge the limitations in our current knowledge. There's notably little research on how ginger may help with more acute cases of nausea, those sudden onset situations we all experience, such as stomach bugs, hangovers, or motion sickness. Similarly, we have limited data on ginger's effectiveness with other stomach ailments, like indigestion or irritable bowel syndrome. That said, there's a glimmer of hope for broader digestive applications. One small but intriguing study from 2023 concluded that ginger could help with symptoms of functional dyspepsia, a type of chronic indigestion that affects millions. Participants in this study reported improved heartburn, reduced upper abdominal pain and burning, and less excessive fullness after eating. While we need larger, more comprehensive studies to fully understand ginger's potential, these preliminary findings suggest its benefits may extend beyond nausea alone.
Part 3. Practical Applications and Product Forms. Given the promising research, how can you practically harness ginger's therapeutic potential? This is where things get both interesting and complex. Ginger comes to market in numerous forms: raw root, dried spice, tea, soda, lozenges, and capsules. Each has its place, but they're not all created equal when it comes to therapeutic effectiveness. Dr. Joshua Forman, a gastroenterologist at the University of Maryland's St. Joseph Medical Center, provides clear guidance based on his clinical experience. He often recommends ginger supplements to his patients with nausea, and his reasoning is both practical and scientific. Supplements offer more consistent dosing than raw ginger or ginger-flavored foods and drinks. Additionally, they're better tolerated by people who don't appreciate ginger's intense, spicy flavor. Dr. Forman's specific recommendation: 500 milligrams twice daily to treat nausea, whether it's from chronic issues like morning sickness or short-term ailments such as stomach bugs, hangovers, and motion sickness. While he acknowledges there's less research on acute nausea situations, his clinical experience supports this approach. But what about all those ginger ales, teas, and candies lining store shelves? Here's where consumers need to be particularly savvy. While it's possible that ginger-containing products like flavored ales, teas, and candies may help ease nausea, very little research has been conducted on them specifically. More importantly, they're often significantly less concentrated than supplements, meaning you'd need to consume much more to achieve the same therapeutic effect. Dr. Crichton provides a striking example of this concentration disparity. You would need to eat 3.5 ounces of candied ginger, that's between 2 and 4 typical servings, to get the same amount of active ginger as found in a single 300 milligram supplement. Even more concerning is the quality issue. In a 2017 study, Dr. Crichton and our colleagues tested popular ginger teas and found they provided only 0.04 and 0.15 milligrams of ginger per serving. Dr. Forman warns that the same problem exists with many ginger ales, which might contain only ginger flavoring rather than actual ginger. His advice is clear and practical. Be careful and read the label. This isn't about dismissing traditional forms of ginger consumption, but rather about setting realistic expectations and making informed choices about therapeutic dosing. Part 4. Safety Considerations and Practical Recommendations. While ginger's benefits are impressive, responsible health information must always address safety and potential interactions. Fortunately, ginger has an excellent safety profile, but there are important considerations for specific populations. Dr. Crichton emphasizes that although ginger in any form is generally considered safe, certain individuals should exercise caution. People taking blood thinners, immunosuppressants, or medications for blood pressure or diabetes should consult with their healthcare provider before using ginger regularly as a supplement. This isn't because ginger is dangerous, but because it may interact with these medications or affect their efficacy. The side effects of ginger are typically mild. The most commonly reported issue is increased burping, hardly a serious concern for most people. Some individuals may experience mild digestive discomfort, but serious adverse effects are rare. Dr. Forman's final assessment captures ginger's place in modern healthcare beautifully. He notes that ginger has few side effects and is supported by legitimate science, making it a valuable arrow to keep in the therapeutic quiver. This perfectly summarizes the evidence-based approach to natural health solutions, not as miracle cures, but as valuable tools supported by research. So what's the bottom line for our listeners? Based on current evidence, ginger supplements containing 500 to 1,200 milligrams of dried ginger root powder appear to be the most reliable form for therapeutic use. The research supports their effectiveness primarily for nausea related to pregnancy, chemotherapy, and surgery, with promising but limited evidence for other digestive issues. For those preferring traditional forms like tea or ginger ale, they may provide some benefit, but read labels carefully and manage your expectations about potency. When it comes to acute nausea from stomach bugs or motion sickness, while the research is limited, many healthcare providers, like Dr. Forman, support trying ginger based on its safety profile and the biological plausibility of its mechanisms. Thank you so much for joining us on this evidence-based exploration of one of humanity's oldest and most trusted natural remedies. Your time and attention mean everything to us, and it's listeners like you who make this work possible. If you found this information valuable, we have a favor to ask. Please subscribe to our podcast, share this episode with friends and family who might benefit from evidence-based health information, and leave us a positive review. Your engagement helps us reach more people with accurate, scientifically grounded health content. Every share, every subscription, and every comment helps build a more informed, healthier community. Join us next time as we continue exploring the fascinating world where ancient wisdom meets modern science. Until then, stay curious, stay healthy, and remember, the best health decisions are informed decisions. Important medical disclaimer. The information presented in this podcast is compiled from published scientific literature and research, but it is not a substitute for professional medical advice, diagnosis, or treatment. While ginger is generally safe when used in food amounts, the use of ginger supplements, especially during pregnancy or if you have underlying health conditions, should be discussed with your physician or qualified healthcare professional. Please do not use this information for self-diagnosis or to treat health problems. Always seek the advice of your doctor or other qualified health provider with any questions you may have regarding a medical condition.